The title of today's lecture is Concerns About Having a Second Heart Attack or Stroke. I'll start out with a little personal recounting. And I want to dedicate today's lecture to Dr. Parks, who did the angioplasty on me last week, which was tremendously helpful. Did a great job. When I was 3 years old, I was in the hospital having my tonsils out. 61 years later, I was having a heart attack. That was the second time I was in the hospital. That was over 7 years ago. Now, the symptoms of my first heart attack were feelings of indigestion. It felt like heartburn. And it was going on for several months. We thought it was an acid reflux. Well, one day in the morning, and by the way, most heart attacks happen in the mornings, and particularly Monday morning, and mine was on a Monday morning 7 years ago. But then I went on for an hour with the heartburn, what I thought was heartburn. And I started sweating. My wife kept saying, let's go to the hospital, let's go to the hospital. So we went. And it was a full-blown heart attack. I went in. There's two main arteries going into the heart. Each of those then branches into other arteries. One of them, what's called the widowmaker, was blocked 90%. So they put a stent. Now, they say if you come into a second heart attack, you'll have similar symptoms to the first. Once you have one, you're always concerned about a second. And so I felt, well, if one artery is closing, probably others are. So I went to a process called chelation therapy, which I'll talk about later, to help remove plaque from the arteries. I took off immediately 10 pounds of weight to help prevent something else from happening. But the symptoms, it turns out, will be the same if it's the blockage in the same artery. So last Tuesday, I was getting symptoms of a numbness in my face. I started feeling confused. And I started feeling weak. Well, bottom line was not a heart attack. But an artery, the other main artery, was 80% occluded. So I'll show you a diagram. It was 80% closed. This is before Dr. Parks put in the stent. That's after he put the stent in. So he opened it up, get the blood flow going in. The procedures, they come up the groin, through the artery. All my arteries look great, including ones going to the kidneys. So the symptoms I was getting was different, and I knew for about 3 weeks. I was telling my wife, I was telling others, I feel a heart attack wanting to come on. I felt something. I could tell I know my body very well. And again, this one, the symptoms also were early morning. This one was on a Tuesday morning. So the time of greatest vulnerability is in the morning. So a good thing to do on medications is to get up early, take the medication right away, whether it's aspirin or AC inhibitor, beta blocker, whatever you're on. If you've had a heart attack, you're on medications, or you have hypertension, you want to get it early because that's most likely when it's going to hit. Now, blood pressure consists of the systolic, which is the top number, diastolic, the bottom number, and also you get your pulse rate. So normal blood pressure is about, a really great blood pressure is like 110, 115 over 70. Mine had been normal for a while. I had labile hypertension over the last year. It was just shooting up and down. Causes unknown. So, but then lately, it was shifting up. I take my blood pressure pretty regularly. And it had been normal for a while. All of a sudden, it was averaging about 118 over 65 with about a 65 pulse, which is good. But in the last 3 weeks, it had shifted to like 140 over 70, which in and of itself is not a problem. That's why it's good to know your baseline. Because for me, I knew it was a problem. Something was wrong. That was a big elevation. wouldn't know that if I didn't know the baseline. I know my blood pressure very well.